In the region of the World Health Organization Eastern Mediterranean office, there's a disparity between the rich countries and the poor countries. And yet, it is the poor who have to pay out of pocket to get their health services. We have with us Dr. Hassan Salah to help us understand the importance of the partnership between the public and the private health sector.
Thank you very much, Dr. Ibrahim. Actually, in our move to universal health coverage, engagement with the private health sector is a priority. Why? Because the private health sector is taking the lead right now in delivering of the service in most of the countries in our region.
Like which countries now the private sector people are having to pay out of their pocket even they are poor?
Mainly the group 3 countries, which we call the low-income countries, like for example Pakistan, Afghanistan, Yemen, Sudan, Somalia and Djibouti.
These are the poor people and yet they have to pay.
Actually, this is the case. They contribute much more. I mean, to give you the numbers, on average it is around, say, 40%. This is the average in our region. While for these countries, they are contribute more than 60%. So can you imagine this is a situation? It's very serious.
So it should not
be the case by any means.
Not be the case. Something needs to change. So what is WHO planning to do in order to switch that round?
We need really to have kind of a strategy and a framework for action for our region here about how we are going to effective engagement with private health sector to have a role in universal health coverage. Let us put some kind of facts. None of the countries, without exception in our region, that they can afford to go for universal health coverage only
depending on their
public sector by any means.
Even the Gulf countries that are wealthy enough.
No way. I mean, look for the situation and the magnitude of the private sector in these countries, in the Gulf countries. They are booming in most of the countries.
Is it because they feel they will get more care or better care if they go to a private practitioner? This myth, although in preventive healthcare, actually speaking, in many, even the poorest countries, if you go for preventive healthcare, it's better with the Ministry of Health facilities. And yet, everybody in their minds think, if I go to a private doctor, I'll get the best care.
The reputation, believe me, and hospitality. The hospitality is very good. They have good information system. They know how to deal with the patient.
How they meet the patient.
Exactly, this kind of. But if you are talking about the technicality, more or less they are the same. But the public sector, they have the poor of giving good quality of the service. This is the thing, yes.
So how the paper that was presented is encouraging all the ministers of health who are present to try to engage the private sector. Dr. Hassan, has this created some reluctance on their part, some apprehension, some fear of losing their clout?
Sort of, yes, definitely. You are right in this, sort of, because still many countries, they are a little bit reluctant to give the power to the private sector. But actually it is not the case by any means.
They will still be the regulatory mechanism.
Of course, they will be in charge to put the regulations. So they will little bit step back from delivering of the service, let the private sector deal with this, dealing with delivering of these services, and while the ministries of health, they are going to full controlling the regulations, in which this is a situation right now that there is kind of weakness for enforcement of the private health sector regulations. And more important than the private sector is enjoying and take advantage from such kind of weakness.
In the countries that you've visited or the countries you're working with, which countries have come forward, have laid the foundation, so to speak, or are willing very much to engage the public sector?
You mention, yes, Iran, for example. Iran, they are very good example, excellent example that they have right now very strong public-private partnership. Very good, and more than they have the experience, they have successful experience. This is the thing.
So we need to exchange information between the countries.
We mentioned this. That's why we, as a WHO, we are going to have complete health topic in our website, official website, talking about the private health sector and the country's experience. Yes.
Thank you very much, Dr. Hassan.
My great pleasure. Thank you very much.
There is hope for the poor yet, for universal health coverage to reach everyone, if we manage as WHO to engage with the ministry sufficiently to ensure health coverage for every person everywhere.